Hi, my name is Maggie Lansford, and I am researching bipolar disorder. I'd like to introduce the disorder with its definition and characteristics according to the DSM-4, and then talk about its history. Finally, I will discuss the treatment options briefly and list my references. Okay, the definition of bipolar disorder is a mood disorder characterized by brief periods of mania that alternate with periods of depression. Typically, there are lapses or breaks in time between the episodes, but as the disease progresses, they go closer together and the episodes are stronger and longer, especially without treatment. According to the DSM-4, a manic episode is a period of abnormally and persistently elevated or irritable mood lasting at least 1 week. Persistence of at least 3 of the following must also be true. So they must also be experiencing inflated self-esteem or grandiosity, decreased need for sleep, more talkativeness than usual, or pressure to keep talking, flight of ideas or the experience that thoughts are racing, distractibility, increase in activity or psychomotor agitation, excessive involvement in pleasurable activities that have a high potential for painful consequences. And while it's important to know what a manic episode consists of because they are present in bipolar 1 disorders, it's also important to note that they are very rare without an alternating depressive episode. So bipolar 1 disorder consists of the presence of a manic, hypomanic, or major depressive episode. It also consists of if they are currently in a hypomanic or major depressive episode, that they have had a history of manic episodes, and also that there is significant distress or impairment. Bipolar 2 is very similar in the sense that it consists of these alternating episodes between depressive and hypomanic episodes. So the difference there is that in bipolar 2, it is not necessarily that they have ever experienced a manic episode. And just to clarify, a hypomanic episode is similar to a manic one. It would just be more subtle, less severe. Symptoms maybe not as noticeable, but it's still extremely productive, extremely high emotional, volatile stage in a person's life. There's also an expectation that the depressive episodes are more frequent and longer lasting than the manic ones for both bipolar 1 and bipolar 2 disorders. While it has pretty straightforward diagnostic criteria according to the DSM-4, just kind of this alternation between depressive and manic episodes, bipolar disorder has not been clearly defined or treatable until recently, as late as the 1970s. Bipolar disorder has its roots all the way back to ancient Greece. The word melancholy, another word for depression, which is one of the episodes that bipolar people suffer from, comes from the words melos, meaning black, and chol, meaning bile. Hippocrates thought that depression was caused by an excess of black bile in the body. So that's where the word melancholy comes from. The other word mania comes from the word menus, meaning spirit, force, or passionate, describing the more spirited, forceful, passionate episodes that you experience when you are having a manic episode. Another ancient Greek, a physician, Aretius of Cappadocia, observed bipolar behavior and suggested that depression and mania were caused by the same disorder. Aretius described a group of patients who would laugh, play, dance night and day, and sometimes go openly to the market as if crowned victors in some contest or skill, only to be torpid, dull, and sorrowful at other times, which is clearly presenting as modern-day bipolar disorder as we would understand it. More recently, in the early to mid-1800s, Two psychiatrists separately hypothesized about and described the disorder they saw to the Psychiatric Academy in Paris, France. The first, Jules Balaguer, called it dual-form insanity because of the alternating episodes between mania and depression. The other, Jean-Pierre Faure, called it circular insanity. Faure also hypothesized that it had strong genetic grounds, which he ended up being correct about. A German psychiatrist, Emil Kraepelin, noticed in the early 1900s that with bipolar disorder, there were intervals also of symptom-free times, and it was by these standards that he differentiated it from a disorder like schizophrenia. Because of this distinguishment, he called it manic depressive psychosis and emphasized an episodic course. In the early 1960s, there was a shift towards noting the dissimilarity between a unipolar disorder like depression and bipolar disorders, and the term manic depressive illness emerged. Because bipolar disorder is less stigmatizing, that term is most popular today. However, many people with bipolar disorder prefer manic depressive illness because they feel it best describes the disorder. In 1970, the FDA approved the first drug, lithium, to be used to treat bipolar disorder. Up until this point, many other treatment options had tried to little or no avail to successfully treat, cure, help with bipolar disorder's symptoms. Lithium's effectiveness in treating bipolar disorder was discovered by accident when, as our textbook states, in 1949, John Cade, an Australian psychiatrist, hypothesized that manic behavior is caused by a toxic level of uric acid in the body. He set out to test this theory by injecting guinea pigs with uric acid, but first he combined it with lithium to increase its solubility. To Cade's surprise, the guinea pigs became not manic, but quite lethargic after their injections. Cade suspected that the lithium had produced this effect. When he later administered the lithium to 10 human beings who had mania, he discovered that it also calmed and normalized their moods. However, even though it is approved by the FDA, lithium must be carefully administered, dosed, and monitored as not to cause lithium poisoning. Drug researchers have since developed a number of other mood stabilizers and antipsychotic drugs to treat bipolar disorder. As mentioned before, lithium was the first and most effective treatment for bipolar disorder. Now, however, atypical antipsychotics are more commonly prescribed for treatment. Antidepressants and electroconvulsive therapy are also not as typical of an option, but they can be used for more severe cases. Another major emphasis in treatment is psychotherapy. Although it does not work well alone, in tandem with drug therapy, many patients can find and maintain long-term relief from their symptoms with both drug and psychotherapy options used adjunctively. So that's a brief summary of bipolar disorder, its history, and its treatment options. I hope you enjoyed the video and that you learned something new. My references are the same as the ones listed in my PowerPoint presentation, including the Psych Central article of bipolar disorder, the U.S. Department of Health and Human Services pamphlet, Introduction to Bipolar Disorder, and our textbook, Abnormal Psychology, 8th edition, by Ronald J. Kummer, as well as a reference that I will list in the YouTube notes section, a Psychology Today's article, A Short History of Bipolar Disorder. Thanks so much for watching.